Well, Saturday was the start of the annual enrollment process for Medicare Advantage beneficiaries. And what I would say is what we're seeing increasingly across the entire marketplace is plans that speak to specific populations who have historically been underserved or unserved. And the LGBTQ plus population is certainly one of those populations. If you think about the era in which many LGBTQ plus older adults, senior citizens grew up, they grew up in the shadows of society. They grew up having to hide their identity. And times are different in 2022. And we want to make sure that part of what we're doing as an organization is being inclusive of all older adults. And that, specifically includes making sure that we're meeting the healthcare needs, the distinctive healthcare needs of people who are part of the LGBTQ plus population. I think having grown up in the shadows, I think many people from this population ultimately feel, have a greater burden of mental health needs, a greater burden of needs in terms of navigating the provider networks, and finding physicians who are sensitive to and can speak to the specific, healthcare needs of that population. And so we were thrilled to be able to partner with Included Health, which is an organization that's has built specific product offerings that are oriented towards this community to make sure that we're offering care that is culturally competent.
And that speaks, we're seeing the progress there. We're seeing even the launch of telehealth and other startups that really cater to this community. Now tell me, how do you plan to do this at scale? Because scale has been the issue for every single company that has ever tried to really push some sort of equity effort or try to really focus on different communities. How do you plan to do that?
Well, I think it requires an organizational commitment. I think there's been a historic view that, populations are monolithic. And I think one of the things that the pandemic taught us was that the only way you can actually move the needle on health outcomes is when you start to think about specific communities and their specific needs. And so, we at SCAN, are joining an increasing, number of companies in the healthcare industry that are actually starting to take a look at specific populations and go deep. We're making the kinds of investments that, historically weren't made to serve specific verticals and specific populations. I think, one example that, you and I have spoken about before are the investments that we made in actually reducing disparities in medication adherence in the African American and Latinx populations. And I think, what we've shown time and time again is that when you pick a particular population, identify the unmet needs, and actually build interventions to address those needs, you can actually move healthcare outcomes in pretty significant ways. And so our efforts in the LGBTQ plus population are just the next example of that for us at SCAN.